Hi, I'm Dick McLandris. I'm our program director. And a key and important aspect of our program is that we have elevated the importance of relationship building to our the way that we operate. We think it's really important that we are as best as we can be in communicating with each other as physicians, residents and faculty, and all of our clinical teachers and our entire healthcare system. How we communicate really determines our ability to be explicit in our teaching so that our graduates are competent and rural ready, and that they're leaders in their community and they can function autonomously upon graduation. And we're able to do that because we live in a community that owns our own healthcare system. Kootenai Health is a community system in which we are leaders at the table. We create policy, we create methodology as we've grown, literally doubling in size in everything that you can count in the past 8 years. It's important to us to pay attention to that relationship building and the competency and the autonomy that's developed. Among the ways we've done that, in addition to having our 666 program, we're now adding another resident to be a 777 1 year at a time. And we've also added a behavioral health fellowship, which brings a 4th year of training to allow one of our 4th year trainees as a fellow to become expert in psychopharmacology and engaging in the community in our need to build as best we can our behavioral health intervention for our community. We've also built a rural health fellowship, which will land a 4th year resident fellow down in Orofino, Idaho for 6 months, and then 6 months up here in Coeur d'Alene, allowing that 4th year of training to expand a feeling of competency and comfortableness living out in a small rural community. We have increased our engagement in the community. We have residents in our Native American system, which is our healthcare system called Mariman Health down in Plummer, Idaho. And we're also landing one of our faculty up in our public health system as we further engage our community. One of the great aspects of our program is we live in a beautiful place. Go outside and you're living in the wilderness almost, so that's a great aspect that we really enjoy because staying well as a physician and getting outside and being healthy is really important to us.
My name is Crystal Pyrak. I'm current core faculty here in Coeur d'Alene. I'm originally from Montana, a small farming community. I grew up on a wheat farm, often driving a combine in the summer with my brothers. I went to the University of Washington in Seattle for medical school, and then went to residency in Boise. After residency, I had the opportunity to do some locums in Idaho, and then went to New Zealand for almost 2 years to work rurally on the South Island, which was an awesome experience, seeing things like universal healthcare and kind of how they operate in really small town. I was really excited to join the faculty here in Coeur d'Alene afterwards, just for the mission to train everybody rurally. Since that time, I've taken over our rural curriculum and really focus on expanding opportunities for residents to go into rural communities, have excellent critical access experience with emergency medicine and inpatient and obstetrics in small towns, and then hopefully find a job there in the future, which is a mission of our program and a real strength. I also am really engaged with the local Native population. I take residents with me down there to work in urgent care. We admit all the local Native patients to the hospital, and it's a real asset to have that cultural experience here in Coeur d'Alene. I'm also really engaged on a state level. I feel it's really important as a family physician to be more engaged, just instead of patient care, which is really important, but also in advocacy and leadership. And so I often go to the state legislature and lobby for issues that are important to primary care and take residents with me. Residents in our program have opportunities to be engaged on a state level or on advocacy boards. And I find that they gain a lot of knowledge and experience outside of just direct patient care.
Okay, so I'm Nathan Birch. I'm the clinical pharmacist at the Residency program. Some information about me. I grew up on the west side of Washington most of my life. Went to school at Washington State University in Pullman, and then did my training over here in Residency after pharmacy school. Some information about me personally. I have 3 boys at home. I enjoy getting out in the mountains whenever possible. I like to do dirt biking, mountain biking, hiking, camping, and then also just enjoy gardening and getting outdoors, out back, whenever possible. I work inpatient and outpatient, so I go to inpatient rounds twice a week. I'm there working up the patients. I'm on rounds for the entirety of it. And then outpatient setting, I help with precepting. I help with managing patients with chronic conditions. Specifically, I work with a lot of diabetic patients, a lot of psych patients, also other chronic conditions, COPD, asthma, and also do a lot of infectious diseases. So through the program, I focus on the medications and helping the residents pick the right medicines for whatever clinical scenario, and also help them manage complex patients who are on numerous medications who want to deprescribe medicines, or help identify medications that are causing problems, which we're using other medicines to treat those problems. So as the pharmacist in the residency program, I am involved in a geriatric polypharmacy clinic, and I'm also included in a behavioral health integration program with a psychiatrist and a social worker, where we work together every week and try to better optimize the mental health of our patients. And we get our notes and work closely with the primary care physicians to help them manage more complex psychiatric illnesses that normally we wouldn't manage in family medicine.
My name is Becca Siemers, and I am one of the faculty at the residency program. I grew up in Eastern Washington and went to undergraduate and medical school at the University of Washington in Seattle. I met my husband there, and we did the couples match and ended up in Portland, Oregon for residency, where I went to one of the University of Washington programs in Vancouver, Washington. And then we moved to Coeur d'Alene after residency to start our careers. So we've been here since the beginning of the residency. I am the Associate Program Director of Clinical Operations at the clinic, and so I help kind of streamline our clinic processes and try to make clinic easier for residents when they're not there every day of the week, update things to keep us very evidence-based. And I'm also in charge of the pediatrics curriculum at our residency, so help to facilitate our outpatient pediatric programs like our Reach Out and Read program and our dental varnish program to help prevent dental caries, and then also work with our pediatric hospitalist team to coordinate the inpatient pediatric teaching that occurs for our residents both at Sacred Heart and at our own hospital, in addition to our postpartum and newborn rounds as well. Other interests that I have in family medicine, I love broad spectrum family medicine. I love OB. I have several multi-generational families, which is really a pleasure and honor to take care of. And I love teaching and really enjoy integrative medicine, specifically looking at nutrition and looking at lifestyle choices that we make that influence the chronic diseases that we have and ways that we can help improve those. Outside of work, I am married. My husband is a hospitalist at Kootenai and loves teaching as well, so a lot of the residents hit him up for questions when they see him in the hospital. And I have a 18-month-old son who is busy and keeps us very active, and a 7-year-old Labradoodle who is also incredibly busy. We love being outside when we're not working, skiing, hiking, riding our bikes, going out on the water, all the things that people do when they're in Coeur d'Alene.
Hi, my name is Bill Miller. I'm a psychiatrist, and I do the behavioral health aspects of our residency. I've been here since the beginning. Started out in my career after graduating from medical school at Northwestern in Chicago. I did a residency in OB/GYN, practiced for about 6 years, then went back to Oregon Health Science University and did a residency in psychiatry. Worked at the University of Kentucky for a number of years before moving back out west to Coeur d'Alene in 1990. Tried to retire in 2011, and Dr. McClandress asked if I'd be willing to help with the behavioral health part of the new residency program. And it's been a real joy to spend time with young residents and involved with teaching. We have a strong focus on psychopharmacology in the outpatient setting. We have elective options with inpatient, youth, adult, chemical dependency programming. We spend a lot of time on support issues. Wellness is a big priority that we have. We have a couple of groups a month that meet to support our residents in dealing with the changes that occur in residency. Really enjoy working with the people that we have. We've had some great residents and look forward to further contact with very good people that are coming to our area. Raised all 4 of our kids here. My wife and I live out in the country a little bit. It's a great place to live. We look forward to meeting you. If you have any questions about behavioral health, you can sure contact me directly through the residency program. I'd be glad to get back with you and discuss any questions that you might have.
I am Ryan Gillis. I'm the Associate Program Director for Academic Operations here at Kootenai Family Medicine Residency. So the pieces of the curriculum that I oversee are primarily our didactic curriculum. We have didactics every Tuesday afternoon for the entire afternoon. And we try to mix in hands-on and interactive sessions with more traditional lectures and simulations and journal club and all of the usual things that people are used to seeing in their didactic sessions. I also oversee our quality improvement and scholarly activity curricula. We make sure that everyone gets opportunity to learn how to perform a quality improvement project and has a format for presenting scholarly work through residency, which is a requirement. Otherwise, within medicine, I have some niche interest and experience in working with patients living with HIV and AIDS, and am able to maintain a small panel of patients as their primary care provider in our office. I also, as part of my duties, help oversee our clinical competency committee, which is a required aspect of every residency program. In most programs, this kind of operates in the background as a group that oversees resident progress through training. We've developed a more interactive model for our clinical competency committee so that residents are an active, engaged participant in their own learning and help monitor their own progress and develop their own learning goals through training. On a personal level, I'm married, have 2 boys who are in 7th and 5th grade. We spend a lot of our free time doing a lot of the great outdoor activities around here, like a lot of people, hiking, camping, biking, running, playing on the lake, water skiing, fishing, all of those sorts of things. We also spend a lot of time chasing our kids around sporting activities and robotics and other fun things like that. We enjoy gardening and have a robust backyard chicken venture with 10 chickens in our backyard that we like to chase around and get nice fresh eggs. We love living in North Idaho. It's a great place to be, both to live in the city and spend time outdoors and get out more remote more quickly.
My name is Jonathan Schupp. I've been on faculty here at the residency program for about 7.5 years. I grew up in the area down in Moscow, which is about an hour south of here, and had a journey through medicine, including going to medical school at University of Connecticut, and then residency at UCLA, which then brought me back up here to teach in the residency program. My responsibilities in the program include I do the curriculum for the inpatient service. I also am the Director of Medical Student Training here through the University of Washington. And so we take on clerkship students as well as sub-interns to complete their rotations here. Personally, I'm married and have 3 young daughters who are fully engaged in the community and do all the fun things that we all like to do, including hiking, skiing on a regular basis, and enjoying all the bodies of water that we have here.
Hi, I'm Britta Bailey. I'm one of the junior faculty members here at the program. I moved here from New Mexico and actually trained here in this program for residency. I came up here with my husband and we had 1 child when we moved up here, Wyatt. He's quite a character. And then I recently had another child, so we have 2 boys now. We love the outdoors. We've lived in the outdoors our whole life, and so we love being in North Idaho for fly fishing, for elk hunting, We have bird dogs, so we love getting out in the mountains and hiking and enjoying all the water there is up here. It's been a nice change from living in the desert. Here at the program, I'm in charge of different curriculum. I'm the current director of the Emerge program, which is our title that we have for our chemical dependency in pregnancy program. So we do medication-assisted therapy for women who suffer with opioid addiction, meth addiction, alcohol addiction. And we run that by committee. There's all of our faculty are MAT waivered, but we kind of have a lead right now, which is me. I also have a big passion for ultrasound and clinic-based ultrasound, so I head up the point-of-care ultrasound or POCUS curriculum. I'm the faculty chair for the resident wellness committee and support the residents in all sorts of different fun wellness initiatives, whether it's from our intern rafting trip to our resident retreat to kind of spontaneous wellness events throughout our didactics. And I'm also the chair for the ICU curriculum. I work here at Kootenai, and I used to work for the past 2 years down in Orofino, which is one of our critical access hospitals that Kootenai Health has recently acquired in their emergency department. And so I'm a big advocate for really broad spectrum, full scope training and residency so that you can go out and practice and feel competent in rural settings.
I'm Anna Chase. I'm one of the faculty here, one of the newest faculty. I am from Michigan originally, the Upper Peninsula, right near Lake Superior. I trained in Detroit for medical school, and then I went to University of Wisconsin in Madison for my residency and also completed an academic fellowship there. I came to Coeur d'Alene because I really love the area. I love the program. I love the people, which I'm sure everyone has already said today. And my spouse and I just really love getting outdoors. We like to ski, we love snow, and this area really allows us to enjoy our work and then spend time outside of work doing other things we enjoy. In the program, I'm mostly responsible for a lot of the GYN curriculum as well as OB. I help on our Emerge group, and I do a lot of obstetrical ultrasound as well. Hopefully we'll be getting more involved in the public health department here, and my role in that is going to expand as well.
We have a really good time together. Our faculty and our residents spend a lot of time hashing out all kinds of things that happen. So traveling through a residency, it's important to take time to get away. And living here in Coeur d'Alene is such a wonderful opportunity to be outside and spend time out in the wilderness. I myself grew up with my 4 brothers in Wenatchee, Washington on the Columbia River. And I grew up in an orchard where 5 boys tried to kill each other every day, driving tractors and shooting BB guns. And we all survived, and we learned how to be outside quite effectively. And when I learned that I had an inside job called being a physician, then I had to make sure that I was doing whatever I could do to get outside. And so being here with this great group of faculty and residents and admin team gives me a chance to be outside and enjoy the wilderness around us.